A recent study found that in the U.S., 1 in 12 doctors, and this is getting back to the root cause of some of this, have received payments from opioid makers. In Ohio, where opioid abuse we know is rampant, there were 793 million opioid doses prescribed. 793 million. And of course, the question is, who's to blame for this ever-growing crisis? And I'm going to get your input here in a minute, Mary, because that's the tough part of this. Who is to blame? Is it the individual? Is it the healthcare system? Is it the individual doctor? Is it the pharmaceutical industry? There are a lot of places we could place blame, but joining us now with a unique perspective is ex-pharmaceutical rep and now lawyer Mychal Wilson to give us a little insight from his experiences, because it sounds to me like a lot of people you worked with were really encouraging the behaviors of doctors to overprescribe opiates. Is that fair to say?
Correct. I think so. I've done some crazy things in terms of I was directed and guided by management to do this, else I would lose my job. And so one of the things I would do is I was a top rep in downtown LA. So I had a lot of the big hospitals, prestigious hospitals. So I was able to funnel money to physicians to get into the back office. I would actually pull patient charts. So I would say to the doctor, you know, he or she saying, hey, here are 12 patients that need to get on this medication. If you don't put them on this medication, then there's no more Lakers tickets, there's no more alcohol, there's no more dinners, there's no more cash payments, there's no more consulting agreements, there are no more fly-to programs that say Las Vegas or to Costa Rica. There's no more fishing trips. I mean, I can go down the line. Now, I have clients who pretty much topped that, where physicians were induced to do certain things with hookers and blow.
Mike,
yeah. And I'm
horrible. I mean, I would love to have a very spirited, intense conversation with the people doing this. And I mean, as a physician, I'm disappointed. Like, aren't you disappointed in our colleagues?
We personally, as point of clarification, have never experienced it.
Right.
And unequivocally, nothing even remotely close has ever happened like that to me.
I'm appalled that a doctor would let them look at the records. That's against the law.
But they also
It is.
cocaine,
so I'm really upset
they're
with you,
breaking so many laws that one more, why?
Yeah, at that point, it's true.
It doesn't matter. I mean, it is changing. We do have to take mandatory classes in opiate use, dosaging, prescribing, guidelines, et cetera. Does that make a big difference? I don't know. But I think all of the states, state of California for sure, is disciplining more doctors. It's more difficult to prescribe these things. They're watching the people that are prescribing a ton of opiates, painkillers, addictive medications. They are watching it, and there are a lot of doctors losing their licenses.
And they should.
So the other element of this is, I've heard that some states are starting to sue pharma companies. I know that there are some situations where even doctors who are unscrupulously prescribing medications may be getting sued as well. Are you seeing this?
The big question is, who do you sue? Do you sue the manufacturer when genuinely they're putting out a product that helps people?
Yep.
Let's not forget about it. I've got a brother dying of cancer who needs that morphine because he would be in tremendous pain every day. Okay, and then you have the distributors who out there abusing, you know, giving you gifts, giving you, presents for selling their pills. And then you have the individual, and you're losing focus too on the individual here, because my job was the aftermath. Here I've got the individual in front of me now. What do I do with someone who is addicted? And I just keep thinking about an instance when I went to the doctor and I had a cold and whatever, and she was new, a new family doctor, and to me she was new. And she says, well, I'm just gonna give you some codeine. And I would love to have her codeine, trust me, And I said, I'm sorry, doctor, but I can't have that because I'm an alcoholic. And she gave me something different. So the people who would stand in front of me, who would have 4 or 5 different, prior charges, and they'd be back in front of me on a drug charge, and they'd say, well, the doctor gave me the prescription. Well, did you not tell your doctor that you're an addict? Did you not tell your doctor that you have a problem? Well, no. So, you have to look at the totality of what's going on and all of the players that are involved.
Look, we're not going to solve the opiate crisis in one day, in 1 week. It's going to take some time, but acknowledging it exists is the first step.